In emergency medicine, you have these big, dramatic interventions, and then you have things that are deceptively simple. Today, we're diving into one of those, an essential electrolyte that, in the right hands, is an absolute lifesaver. We're talking about calcium gluconate. So let me start with a question for you. What single electrolyte has the power to pull someone back from a life-threatening overdose and stabilize a dangerously chaotic heart, sometimes in just a matter of minutes? Well, the answer is calcium gluconate, and in this explainer, we are going to break down exactly how it pulls that off.
All right, so here's our game plan. We're going to start with the absolute basics of what this stuff is. Then we'll get into its critical missions, the risks you have to know about, the right way to give it, and we'll wrap up with some essential details that make all the difference when things get serious.
Let's jump right in with the fundamentals. First up, what exactly is calcium gluconate?
So calcium gluconate, or CalGlu, as you'll hear it called, really wears two hats. It's an electrolyte and it's an antidote. But to get why we use it as a medicine, you first have to appreciate just how critical calcium is for, well, everything. It's the spark plug for our nervous system, it's the power behind our muscle contractions, it keeps our heart beating in rhythm, and it's even a key player in making our blood clot. When any of those systems go haywire, giving calcium can be like hitting the reset button.
Now, you're going to hear calcium gluconate mentioned in the same breath as calcium chloride, and you absolutely need to know the difference. Calcium gluconate has about a third of the active or elemental calcium as calcium chloride. This makes it way, way safer for a standard peripheral IV. Why? Because if the more potent calcium chloride leaks out of the vein, that's called infiltration, it can cause some serious, and I mean serious, tissue damage.
And how fast are we talking?
Oh, it's fast. We're looking at an onset of action in just 5 to 15 minutes. Its effects can last for up to 4 hours, depending on the dose. That rapid action is exactly what makes it so valuable in an emergency.
So now that we know what it is, let's talk about its critical missions. Section 2. When do you actually use this stuff? Knowing its indications is everything. The number one reason you'll see it used is for hyperkalemia. That's dangerously high potassium. See, high potassium makes the heart's electrical system super irritable. And what calcium does is it stabilizes the cardiac cell membranes. It basically puts up a protective shield around the heart cells to keep them from firing chaotically. It's also, of course, used for hypocalcemia or low calcium, and it's a direct antidote for an overdose on calcium channel blocker medications. And finally, it can also counteract hypermagnesemia, which is a dangerously high level of magnesium. But listen, for a drug this powerful, the rules of engagement are just as important. So Section 3 is all about the risks, because knowing when not to use a drug is just as important as knowing when to use it.
And this right here, this is your hard stop, do not pass go list. It is absolutely contraindicated in patients with digitalis toxicity, and we'll see why in a second. Obviously, it's a no-go if the patient already has high calcium levels, which is hyperkalemia. Same goes for a known hypersensitivity. And finally, sarcoidosis, a condition where people can have trouble regulating their calcium, which puts them at a super high risk for toxicity. Even when you use it correctly, you've got to watch out for some potential side effects. It can cause a sudden drop in blood pressure or hypotension. Some patients report a weird metallic taste. If that IV infiltrates, it can cause severe tissue death or necrosis. And critically, it can cause bradycardia, a dangerously slow heart rate. And let's be absolutely crystal clear about that last point. We're not just talking about a slightly slower heart rate. If this drug is given incorrectly, it can slow the heart down so much that it leads to a systole, a flatline. We're talking cardiac arrest. Remember we said no-go for digitalis toxicity? Well, here's exactly why. This quote from the literature says it all. Calcium may worsen dysrhythmias caused by digitalis. Giving calcium to these patients can actually be the thing that pushes them into a lethal heart rhythm.
Okay, with all those risks understood, let's move on to the execution. Section 4. How is calcium gluconate actually given?
This table lays out the standard dosing for hyperkalemia and calcium channel blocker overdoses. For an adult, you're looking at 1 to 3 grams, given IV or IO. For kids, it's weight-based as 60 milligrams per kilogram. But here's the part I really want you to focus on, the speed. For adults, it's pushed over at least 5 minutes. For peds, it just says slow. The key takeaway for both is simple. You have to give it slowly.
And just so you know what you're looking for, when you're drawing up that dose, you're almost always going to be working with a 10% solution. It usually comes in a 10 milliliter vial, which makes the math pretty easy. That's 100 milligrams for every milliliter.
All right, we are almost there. Let's cover our final section. What else to know? Think of this as the final briefing. These are the details that ensure you're using it safely and effectively.
This checklist is absolutely vital. 1. Go slow. We've said it before, but pushing it too fast is what causes that dangerous drop in blood pressure and heart rate. 2. You have to monitor that IV site like a hawk to prevent tissue damage. 3. Check hemodynamics. That just means keeping your eyes glued to the heart monitor and the blood pressure cuff. 4. In pregnancy, yeah, it crosses the placenta, but you should not withhold it in a high-risk situation. And 5, this is a big one, it's not a routine drug for cardiac arrest. You only use it if the arrest is specifically caused by one of its main indications, like hyperkalemia.
So there it is, calcium gluconate. It might be a simple element, but it's used for incredibly high-stakes interventions, where the line between helping and harming can be razor thin. Using it demands respect, knowledge, and a ton of precision. So the only question left is, are you prepared?